And let us now begin with the first part of the day today. That is talk by Dr. Sonika. She will. We have been learning from various source person about sustainable and startup in various areas, including healthcare. But today, Dr. Sonika will deliberate on AI in healthcare, hype versus reality, an excellent topic because healthcare is affecting all of us, including in education, in our personal lives. So Dr. Sonika will be, giving her thought about that, and I think we have one of the best resource person for this particular task. And I would like this take this opportunity to welcome Dr. Sonika on behalf of Hans Raj Mahila Maha Vidyalaya, our worthy principal, Dr. Mrs. Ajay Sreen, the coordinator of this FTP, Dr. Gagandeep, and the co-coordinator, Dr. Seema Khanna, and the entire team of Hans Raj Mahila Maha Vidyalaya. Dear participant, it is my privilege to introduce Dr. Sonika to you. Dr. Sonika is an associate professor in digital health and bioinformatics research lab at the School of Computing Technologies in Data Science and AI division at RMIT University, Australia. She is also an affiliate machine learning scientist at Monash University, Australia. Her expertise is in developing new machine learning, AI and tools, pipelines, and algorithms, and apply these methods to solve biological clinical research questions. Her current research focuses on integrative approaches to digital health and genomics. Sonika has contributed a lot in the society. Her contribution, garnered recognition in form of various prestigious awards and fundings. Sonika was the finalist for Women in AI Awards Australia New Zealand 2022 and a Healthcare Innovator Award in 2024 in the AI in Healthcare category. Sonika was named as a Brilliant Woman in Digital Health 2023 category. And Sonika is an elected member of the Victorian branch leadership of the Australian Institute of Digital Health and sits on the medical advisory to Australian Research Council and on the steering of National AI in Healthcare Roadmap of Australia. Sonika believes in paying it forward and has been mentoring young linguistic and sits on the medical, you know, AI. Sonika believes in paying it forward and has been mentoring young minds in various educational institutes in India, including HMV over the past decade. We are honored to have Sonika, visiting our college 2 times and helping us in many online initiatives. She's actually a motivator for many of our students of mathematics and science as well. So, Dr. Sonika, I will not stand much behind you and the participants. I think it's a great honor for all of us to invite you. And stage is yours. All the best. Thank you very much.
Thank you so much, Dr. Harpreet, for such nice introduction. And I also being coordinator of this FTP, and I welcome and good afternoon to everyone at this final stage of this FTP. So let us wrap up this remarkable FDP and remember the journey of past 5 days in which seeds of sustainable innovation have been already sown. So now it's time to nurture and watch them grow. So let us start with today's session of Dr. Sonika Tyagi with same positivity and energy we have been coming up with in the earlier days. Dr. Sonika, over to you.
Okay, so I would like to confirm once again, you can see my slides in full screen?
Yes, yeah. Absolutely.
Thank you. Thank you. And thank you so much, Harpreet and Gagandeep, for kind invitation as well as kind introduction today. And it's always truly a privilege whenever I get an opportunity to be a participant in any event that's happening on Indian side, and especially if I'm talking about the work that I'm doing in this area. So it's always a privilege and an honor. So thank you for having me here. And in terms of my educational background, I actually studied in India, and my bachelor, master's, and PhD was done in India. So during PhD, I visited Australia, and then that opened a pathway for me to return to Australia after finishing my PhD. And my PhD was in bioinformatics, and during bioinformatics PhD research, half of my research was dedicated towards developing language model for small RNA structures, and that have important role in diseases and biological pathways. At that time, the term AI as such wasn't being used so much, but there was a lot of machine learning involved in bioinformatics domain. And in the past few years, like I would say last 5 or 6 years, we know that data is becoming digitized, and digitized data from healthcare domain started to become available more. So then I expanded to look into the healthcare side of data. So we know that for health, so any healthy condition, or the opposite of it is not healthy, maybe a disease condition, there is an interplay between your genetics and your lifestyle and maybe some other events that are happening, right? So I've already been working in the genetic side of things and looking at data from DNA, RNA, protein, those biomolecules. Now, if you could also look at data from the medical history, other environmental factor, other comorbidities, then you could put the picture together and you get a holistic view of a person's condition. Okay, and that helps you determine what factors that might be causing the disease, and also to understand the progression, and then may be able to use all of that information into doing an early diagnosis, correct diagnosis, as well as treatment plan. So that's where my has been my journey, how I have entered from computational biology and going towards applications in digital health. So I currently I work at a computing school, which is just another name for School of Computer Science. And I sit in the data science and AI division. I teach courses around artificial intelligence and data science, and I lead a research group at that school. Okay, so I don't know, I mean, how much there'll be interest in knowing about what's happening in healthcare, but I'll try my best to connect the topic of AI and healthcare, and be able to get a connection to some real life example that many of you can relate to. Okay, so let's begin with a question. What is AI? And AI, as the word artificial intelligence short form is AI, is being used in many different ways and might mean many different things to different people in different contexts and different use case. So I would like to take this opportunity and pose these questions to you. Think about what AI application you may have used in the past week in your personal life or in your professional life. So think about it, like where you can post a message in the chat. I'm able to view the chat. So you can post a message in the chat and think about where you may have used AI in either in your personal life or in your professional life in just in the past 1 week. Grammar checking, yes. Image creation, yeah. Slide preparation, yeah. And anything in personal life, think about the phone usage, the shopping, the driving, do you think you may have used AI in that aspect also? Content creation, yeah. And I'm going to touch upon that topic a little bit as well. Oh, by the way, how much time do I have to speak?
Its total session is 1.5 hours.
1.5 hours, yeah, that will be good.
We started at 2. We have time till 3:30.
Yeah. Yes. Good. Yeah. So robotic task. Yeah. Any household application. I just want to see if you can think of any household applications that you may be using AI for? Oh, yeah. So robotics, yeah, we do use, let's say, robotic cleaner, you know. Okay, tell me, does anyone have Alexa at home or Google Home? Yeah. So what's happening there when we say, hey, Alexa or hey, Google? This is what is happening. There's a voice activated command that an AI both is taking and then doing some action according to that command. Okay, how about, do you use facial identification on your smartphone or a thumb impression? Yeah. Shopping, when you're doing shopping, and when you have shopped and next time you're shopping, it gives you suggestions on, either it may be giving suggestion on, oh, people who bought these also bought these things, or some ads are popping up giving you suggestions like you may be interested in these items. Those are called recommendation systems, and those are AI-based recommendation systems as well. How about when you're watching movies, either on Prime or Netflix or what have you, whichever platform it is? Again, it's based on your watching history. It might give you some newer suggestions, right? So all of those are AI applications that are happening. And then, a lot of content creation, presentation, and now we have more AI-based tools for grammar check and everything. So this is what, so I want to get at. So what does AI mean? Like AI can mean so many different things, okay? And all of these tasks that we have talked about, we are using AI, knowingly or unknowingly, we are using a lot of AI in our daily life already, and whether we like it or not, right? And then AI might mean, something to do with, developing these applications that can do image classification for me, can generate new text for me. For example, ChatGPT can create new images for me, or can do some other more sort of daily task, while doing shopping or watching movie, or, using a smartphone, and or even writing emails for us. And so all of these are examples of AI, right? Or AI could be just a fancy term, fancy marketing term that is being used to get interest in business, in investment, or new policies. And that's how AI started, basically. So I'll just get a little bit into the history of AI and what AI means. These are some of the textbook definitions, and don't worry about reading this. And I just pasted this 6 different definitions from 6 different textbooks. And these are just to illustrate a point that basically, when we look at, a technical definition of AI, we look at 2 aspects. Either we are talking about machines that have a mind, meaning that they are thinking machine, they can do tasks like humans do. Or we are talking about the process, the computational process, or the behavior of those machines and models. So you could technically define AI like that, but AI is more than just a technical definition. It's more than just some computational algorithms or computational programs. It's also about how you perceive AI, how you're using AI, and how it might have impacted your life. So again, going to the technical definition, we say artificial intelligence is about both studying as well as building or constructing these smart machines that can do the right thing. Okay, so doing the right thing is very, very important aspect, because when we are building these machines, this smart machine that can do all these tasks for us, and some of those tasks look like magical tasks, like, I ask any question from these chatbots like ChatGPT, and it seems to know a lot of things about a lot of my questions, right? So it just seemed like, oh, how does it do that, right? But when we are building these machines, so there is an objective of each of these, algorithms or these smart machines. which is to do the right thing. And what does that mean? As Professor Stuart Russell has said, that these machines are being built by humans, and they are intelligent to the extent that their actions can be expected to achieve their objectives. So the onus is on the creator of AI. How do we set those objectives? Where do these objectives align? What does doing the right thing means? And what are our values? What are the values of our social system, our where we live, and how we are going to use that? And how does the objective of the AI that we are building aligns with those values? So those are some of the like foundational aspect of AI to think about. So as I said, AI may be really nice, fancy. I call it like a marketing term that everyone trying to use, and sometimes it gets overused. But it's nothing new. Like the discipline has existed since 1956. In 1956, this was formally launched as a discipline of computer science at a conference in Dartmouth, and some of the fathers of AI have been listed as John McCarthy, Marvin Minsky, Nadal Rochester, as well as Claude Shannon. And this here, they decided to set, and the fact was that they were actually writing this new research proposal to attract funding, and they decided to use artificial intelligence at that time as a marketing term to attract funding, and it did work. So the idea was, can we build machines that can think like human, that can do problem solving and decision making like human? And that made sense to wider audience, and it did attract a lot of funding. This area attracted a lot of funding in that time. But soon, because we call this as the hype, the initial hype, because we started showing this future where we are going to build machines that are going to do all of the things that human can do. Okay, but obviously we can't build those machines, and over the next 20 years or so, the hype declined, and then there was what we call as in 80s and 90s, this is called the winter of AI, where it was very hard to get funding for any AI based projects because people, the general perception started to become, that is not happening. We cannot build machines that are like humans. So then there've been some other inventions in the area, newer computer hardware as well as software started to evolve, and then there was another wave, and then brought the popularity of AI back into the game again. So the point I wanted to make is not new. We are talking more about AI now, as I said. It's a result of multiple different things. One is to obviously how we sell this terminology, and the other thing is the evolution in terms of both the software side and the hardware side of things. So now and digitalization of data across all disciplines, all fields of life, right? So now we are able to have a lot more information in digital form. We have more advanced both software and computer hardware. We are able to extract information from data faster. We can do computations faster. And then we have these, we are building more and more programs that can learn this information from the data without having to code that information by rules. So originally, the whole idea of AI started off with, our fascination with our brain. We Homo sapiens is the scientific name of human, where sapiens means intelligence. So Homo sapiens means intelligent human. So when we named ourselves, we call ourselves intelligent humans. So we are very proud of our brain, right? And there were always, when we started to think about, building these machines that can work like human, can do decision making, can do problem solving like human, we wanted to understand how our brain works. And so there was, the first effort was in 1958 when we tried to build an artificial neuron, which means, so neuron, those of you may not know, is the cell of the brain. And the function of neuron is to pass information from one end to the other, and multiple neurons work together to do all different cognitive functions of the brain. So they decided to, this bunch of scientists decided to model that and see how can we mimic that behavior to build a computer program that will be called as artificial neuron. And they called it as perceptron, right? Then the modern day, artificial neural network is just set of these multiple perceptron. So you have input. So we give some input signal, and then it gives some output after doing some processing in between. So any structure like this, where we have this artificial neuron or perceptron, and then they are put together in some architecture. Okay, and I'll come to that in a minute, where an input gets processed and gives you an output. So that is called an artificial neural network, which is the general terminology. Now, from single perceptron, we started building this multi-layer perceptron or MLPs. So more layers in between means you can do more complex computation. Okay. And that led to, different architecture of artificial neural network. I don't know, you may or may not have come across this terminology, but if you are studying, in somewhere in related field, you may have heard about terms like CNN, convolutional neural network, or LSTM, or RNN. So these are all different names of these neuron architecture based on how you organize those neurons, okay, and what kind of input these ANNs can process. That's how they got, and what kind of output that they can give. These different ANN architecture got their different names, like CNN or RNN or LSTM, or even transformers that are the core architecture behind ChatGPT. So GPT stands, so T in the GPT stands for transformer, which is one of such neuron architecture or perceptron architecture. And then what we saw that by having these artificial neural network architecture, we were able to process information at a much higher scale, and the computation that you could do were much higher. And here, the ability of these neurons to learn from the data was attractive, that you don't need to code any rules. Like, so think about when you are trying to do a statistics. So you have some rules, predefined rules and predefined expected outcomes, and then you are doing those computation. Now think about all of these rules. The model can learn from the data by itself. You don't need to tell which features to look for in the data, and it's able to give you those answers. And we are using these properties of these artificial neural networks to do a lot of different things. For example, in healthcare, you're able to process images and can detect tumors from images directly. You could analyze X-ray structures. You could do just general image classification. You could do other predictions. So we in fact, in my group, we are building models that can look at data coming from a hospital and can predict the length of stay of a patient in the hospital, or how likely they are going to die, or are there chances of them going to ICU in next couple of weeks. So now we are able to make use of these different complex models and do all these interesting analysis and very useful analysis on medical data. And that made again, I would call it like this also a lot of hype that has happened, because now we started to see, oh, we have now access to data, we have access to this software, we have access to this hardware, we are able to do all these excellent thing. So what does it mean to me as a common man? Okay, how would it change how I access healthcare, or how healthcare providers deliver healthcare? And what does it mean to medical professionals? Are their jobs going to be taken away by these AI models? So these are the questions that we're discussing. And obviously, this last year's 2024 Nobel Prize in Physics went to the some seminal work that laid foundation of this artificial neural network theory also. So this is very happening sort of year for the technology as well. So these are two studies from Australia where we were, so these a group of scientists, it's not my work. So these are a group of scientists that have developed these AI tools that can look at these images and the mole, you can actually have this AI software on your smartphone. It can take pictures of these moles on the skin and can detect whether it is a tumor or a benign pigmentation. And then they also looked at how accurate these predictions were. So they compared the predictions made by the AI with those made by the clinicians. And they concluded that AI was able to do as good as a very experienced senior clinician in this area. And most of the time was better than the medium to less experienced clinician in that area. So here in both the studies, it was shown that you could use AI to assist in diagnosis. Now think about, you have these thousands and thousands of images to scan, and if you could take help of an AI software, the clinician, the pathologist can scan a lot more data faster and can do a lot more computation that are not humanly possible. And sometimes it can bring out some correlation and patterns between different data sets that we were not even thinking about earlier. So what this is doing is that it's augmenting the clinical decision making of these specialists who were using this image data to make prediction, do diagnosis, right? So that's one example. There's been other example where they've been, I even searched some of the news from India, and we are seeing a lot of these promises that are being made by the AI system. That AI system can do better diagnosis and in more complex health conditions than humans, and then AI can beat doctors in accurately assessing eye problem and so on. And then we are seeing the trend that in diseases like cancer, how AI can be a promising tool to be able to do early diagnosis and can do more personalized treatment plan. So you don't need to give the same drug, same medication to everyone who has that disease. You could customize that. You can tailor that medication based on their individual condition. What is their history of medical history, what medical history they have, and what other comorbidities that they may have, which environment they live in, and can the same medication have same positive impact, or can have some side effect on the person. So you could take into account all of these other factors, be able to do more personalized diagnosis and treatment. And there is this one success story that I find very fascinating, where they developed this AI tool where it was able to predict breast cancer from breast cancer image data 5 years in advance. And just think about what positive impact it will have on women who may be living with that risk. It may be in the family history, they may have some early signs. And just imagine if those women can get a 5 years advance warning of developing breast cancer in their lifetime. They can intervene early. They might completely avoid a situation happening in their life, or the severity of the disease might reduce. So this is another, very fascinating example that I have found where AI is helping in making better diagnosis and early diagnosis to have a positive impact and improving quality of life of these women who are living at the risk of developing the disease in their lifetime. And also, there may be some people who are in education and research area, And this was another breakthrough of AI-driven technology, where a tool called AlphaFold that was developed by one of the Google sister company, and it was able to do protein structure prediction at a much faster pace, as well as at much accuracy. So when the AlphaFold was first introduced, it was manyfold more accurate than the next best structure prediction software. And this kind of, in the biomedical domain, it was kind of a triggering point, and we had this kind of wave going through the field and thinking, oh, AI can do lots of these new innovation that can be used to solve these outstanding problems in biology, and can then this has a cascading effect. So by solving more protein structure more accurately, it helps in research and education, doing translation into, let's say, drug discovery, discovering new drugs, developing new vaccines, and so on. So those are, that was another positive impact that was shown by the application of AI in the field. So yeah, we looked at what AI means, what it might mean in different contexts, and what is the technical definition, a bit of history of how the field actually started, and some of the success stories that we have seen that show us a lot of promise for a better future in healthcare. And then let me also just put this different terminology together that we come across when we talk about AI. These are different terminology that we think about. So artificial intelligence is a discipline of computer science, of which machine learning is a sub part of that, which deals with developing this computer algorithm, a computer program that can learn from the data and evolve on their own to be able to make new predictions on new data. So think about this example. So when we are talking about the example of Alexa, and where we are giving a command to Alexa and Alexa does something. So what is this software? This is machine learning software. What is it doing? It's taking voice data. So when we speak, it's a speech data. It's being recorded. And then it tries to interpret the meaning of the data, and then does an action based on that meaning. Okay. Now, think about, just let's take a few steps back and think about how that program may have been developed. Okay. That program may have been developed to recognize human language. So you may be using it in Hindi or English or some other language, and that program may have been first trained on lots and lots of voice data. And this would have been trained to recognize different accent, different pronunciation, different pitch and tempo of your voice, and also thinking about what background noise there might be. So there have been, multiple iteration of the training to be able to develop a program that can recognize voice data and then analyze the data to understand what is the meaning of that voice command. Okay, and then so that is called the development phase. Once the software has been developed, has been tested, then it's put into practice in deployment, and that is the application that comes with Alexa when you buy that device, right? So now, so that is called machine learning, because now what is happening? This program is able to learn from the data, learn the voice patterns, be able to analyze that to understand the meaning. Okay, so that is called learning. So now the software is learning by itself. And when when I purchased that device, now the same software can recognize my voice, even though my voice was never part of the training, hopefully. And so that's called learning from, so these computer programs have ability to learn on their own. And that's called machine learning. And a sub-branch of machine learning is deep learning, where these programs are based on this artificial neural network. Okay, and we call them deep neural network as well when you have multiple middle layers. Okay, so the network architecture is deep, and we call it deep learning or deep neural network. Okay, so that is just clarifying the terminology that you might come across and where it sits in terms of hierarchy. But all of the AI is not machine learning. Okay, all of the application that we are seeing in our life, all of the things that we discussed today are falling in the machine learning area and majorly deep learning. But all of the AI is not machine learning. There are other parts to it. Okay, so how do we develop models? So when we develop any AI models, so what we have is a choice of a model based on what we want to do, what it can do, and then we have data. So there may be some existing data where we are training the model. Okay, then so the example that I was just giving, the voice data. So it may be voice data from a wider population, and once we are happy with we build the model and we are happy with this performance, then we deploy the model and then we apply it to new population, the data that it has not seen during training, but is able to then apply and make prediction for that new data. Okay, and now you can think about all of these applications. So when we are talking about, facial recognition, so again, it may have seen a lot of this data that we are able to then use in this model, and it's able to now do image detection, because essentially what you are doing in facial recognition on your smartphone is it's taking an image and analyzing that and saying whether it's your image or not. Similarly, now you can think about this in healthcare settings. So we may be building a model that can detect people's risk of diabetes. So again, is the model has seen a lot of diabetes data and healthy data to be able to learn the specific pattern that are in the data that is coming from diabetic patients. And then model may be able to predict that now model is ready. And when I give my profile, it's able to tell me what is my risk of developing diabetes. Okay. Now, what is important is that models are learning from the data. Okay, so they are limited in their knowledge to the data that is being used to train them. Okay, so if you are developing, let's say, a diabetes model, and we develop this on a general population, now I want to apply this data to, let's say, pregnant women. Can I apply that? I need to go back and ask a question: how many pregnant women were included in this data that when it was being trained? Because can it make accurate prediction on pregnant data? And why I'm taking this example of pregnant women, because we know that these profiles can change drastically when a woman is pregnant as compared to when they're not pregnant. So in order to generalize these models to wider population, we need to make sure those samples are part of the data training. And I'll come back to this again when I'm discussing the generative AI. So just think about this picture, and that's why I'm showing. There are some people, there's only one person here because it's a rare sample and it's shown in different color. So when you have these samples that are in minority, that may not be well represented in your model, because your model is as good as your data. Okay, so in order to generalize these models to wider population, we need to make sure that those samples for that target population are included. And if they are not, then we have the topic of bias, which I'll discuss in a few minutes as well. Okay, so now why are we able to have all these fantastic application and new breakthrough and new innovation using AI? And one of the main factor is the availability of digital information. Now, digital information is abundantly available in biomedical domain. Let's look at some of the genetic side of information, right? So we know that humans have DNA as their genetic material. So if I represent the entire DNA of a human as green circle, so most of this DNA transcribes into RNA. So the genetic message in DNA goes through RNA and makes protein. And protein do all the function. Your muscles are made of protein. All the enzymes that carry out all the biochemical reactions are all proteins. So proteins are a major player in the biological system. But the middle layer is RNA. So the genetic message in the DNA has to go through RNA to form protein. But not all of the DNA forms RNA, and not all of the RNA forms protein. Only a small portion of RNA forms protein. But what I want to show here is that now you have 3 levels of information. So these days in clinical genomics, it is possible to do sequencing for, let's say, a cancer patient. You could get their entire DNA sequence, can look at their RNA, can look at their protein. And so here I'm showing this picture to show you the heterogeneity of data. So we are already talking about 3 different types of data: DNA, RNA, and protein. Then what is the scale of the data? In human DNA, you have 3 billion letters. Okay, so the length of DNA is 3 billion. It can make more than 200,000 RNA transcript. There are more than 20,000 proteins in human body. So now you're already talking about, even if you generate this data from one sample, you are looking at this as a minimum unit of the data. Okay, and then again, when you're doing a scientific experiment, you may be generating this data for multiple samples. And then if you are looking at, let's say, cancer, no cancer, then you will also have healthy and the tumor data. You may be doing a population study, or you may be doing a study over the generations. So just keep thinking what this keeps on scaling out. We are able to generate so much data just from human beings, and think about other lives on the planet and other organisms that are of interest. So I'm only talking about like from the health side of thing. And there are lots of, there may be, bacteria, the viruses, we have been through a COVID pandemic, and we know all of this vaccine development was possible because we were able to sequence those viruses and could look at their genetic code, and could look at how fast they were mutating and how they were different strains of the virus. So now this is why we have so much data that we are generating. And again, it's a complex picture, and don't worry about trying to interpret this picture. But what I want to show is these labels, that even just for a biological system, and just from the genomic side of thing, you could generate data at the structure level, how the 3D structure of DNA, RNA, proteins are. You could look at the gene, you could look at RNA, protein, and metabolite. So you could have lots of, different type of data that is being generated. And that's why I call it big genomic data, because you are able to generate this data at high velocity, high volume, and it's multidimensional and multiple modalities, because the data can come in many different forms. And this is the reason that, and also the advancement of technology to be able to generate this data at an affordable rate has led to this big growth of data, which is then, outpacing the data that is generated by, astronomy or social media and so on. So every day is the data from biomedical domain is the biggest contributor of digital data. So now this brings about new opportunity, because we have so much data, we can do more innovation, you can discover more knowledge, but also challenges. Now, how do we deal with this? Because look at this, there's so much variety here, and so the size of the data, and also opportunity for researchers, for educators, for businesses now, and also students. There is so much data, and we need skill sets. We need skill sets to be able to make sense of this data. And when we want to make sense of this data, we will have to have both the domain knowledge as well as the digital skill set to be able to, consume this data and get some usable knowledge out of that. And this is just another, table where I'm showing that data can be in text form. It may be signals. The easiest example I can give for signal, for example, ECG data, EEG data. It could be numerical or in image form. So you have these multiple modalities of the data, and they could be different interest for analyzing that data. And these are just some, technical terms. If you're interested, we have published this in a paper. It talks about different format the data comes in and so on, and then what are the algorithms that are being used to analyze those kind of data sets. So that was the biology side of data. Now let's look at data which is from medical side of thing. So we call it electronic medical records, which is the typical data that you will see in a hospital system. So if there is if hospital is storing the data in digitized form. Typically, you would see information on their medication, administrative data like maybe information on insurance and so on, prescription, the lots of notes that doctors and nurses enter in their records. There may be pathology results, there may be just routine vitals like heart rate and blood pressure and that sort of thing. There may be record of immunization. So you have this complete picture of a person's medical history, whether they have visited just clinics, day clinics, or have stayed in have been hospitalized. Depending on where the data is coming from, you may have length and different richness of information in this data. Now you could put this medical history and the genetic information together and can understand what may be the genetic factor that may be driving these patterns that we are seeing in the medical data. And that gives clinicians a lot of power to be able to personalize the diagnosis, personalize the treatment. We are looking at one example I'll give you is we are looking at Women's Health Project, and we look there was a population data where we realized that women of certain ethnic background have a higher risk of still childbirth or a high risk of developing gestational diabetes. And this was possible by looking at the genetic the genetic history, their environment, where do they live, because your geographical location, your family size, your family income, nutrition, all of these have been what we call them as social determinants of health, are able to indicate some correlation with the health outcome. And just imagine, if we are able to record this information systematically for a population, we are able to do more preventative medicine, meaning that you can alert these health risks earlier before they even happen. And then you can intervene early, and then you can have better quality of life, basically, because you don't end up in the hospital. And then from the healthcare provider and from the government side, it's a relief, because you are able to reduce the severity of diseases in a population, and then there will be fewer people coming to the hospital, or they're staying in the hospital for a shorter term. So it takes that burden away from the healthcare infrastructure as well. So this is where I see, and this is the domain where I do my research, and I find this, like myself, very privileged to be in this domain at this time, where there's so much innovation happening in the data space, in the compute space, and we are able to get access to this information and have opportunity to make some small change to improve the quality of citizens. This is another, again, technical information. If you're interested, that's the reference where it talks about, how different type of deep learning models are used to take this data of different types and be able to then fuse it together. So when you fuse data from multiple types of information, for example, here it's showing the genetic information, here it's showing some medical data, some numerical measurement, some image data, you could pull it all together. And we are talking about, and this is the area where I work, where we develop these kind of computational methods that helps us fuse this different type of information together to be able to do multi-model AI. Okay, so that was all about predictive AI, where we are developing these machine learning models. So now I'll move away from the word AI. So now that I have introduced AI, I have introduced machine learning. So let's get down to the correct use of term, which is machine learning. So all we are doing is doing machine learning, where we are developing these machine learning models that learn from the data, and we are able to make predictions on the new data. We are able to get this data from multiple sources. And then because it's coming from multiple sources, it may be coming in multiple forms, what we call as multimodal. And then you need to have specialized methods to be able to process that information, link it up all together, and then use this holistic information to make better prediction. Now let's talk about generative AI. And this is the part of AI that actually brought the AI the word AI to every household. Now, everyone talks about AI because of the generative AI, how it has really, escalated in last few years, and the access to chatbots, which are generating new information. So as opposed to predictive AI, where we are developing models that can do new prediction, generative AI is about generating new content. You may be generating text. So when you say, okay, give me information on this topic, or find me a restaurant, or give me this recipe, or solve this maths equation for something, like whatever prompt it may be, is the text information you're providing, and then it gives you an answer. Or you may be generating images or video, or people are doing lots of other complicated fancy stuff as well. So what does generative AI mean? Generative AI means it's generating entirely new content, but again, based on its training on the training data. Okay, so let me ask you this question. When I ask you to complete this first sentence, I say, the bird flies in the, what will be the next word you will predict? Give me an answer in the chat. When I ask you to complete this sentence, the bird flies in the, what will be your answer? So complete this sentence. So you see, everyone is, can predict. How do we know this answer? How do we know this is the answer? We know this answer because we understand this language. We know our, surrounding, it's our experience. We know the bird flies in the sky, or there could be another possibility, bird flies in the air. Maybe there was another variation of this, but majority answered sky. Okay, let's look at the next one. The cat sat on a, what will be your answer to complete this sentence? Okay, so here I'll now talk about the probability. So you see there in the first sentence, the highest probability was that there will be the word sky to complete that sentence. But in the second example, there's lots of words that are possible as the next word. Okay, so there is, now we need to look at which one will be the most probable word. Okay, then in order to predict the best word, we need to look at more information. Let's look at the last example and then I'll discuss that topic. So when I say I love apple, what do you think I'm talking about here? Apple the fruit or Apple the software company? How do you know? How do you know? Can you tell from this sentence, by the way, whether I'm talking about the fruit or I'm talking about the software company? How do you know? Whoever is answering either way, either fruit or software company, how do you know what I'm talking about? Give me your reasoning. Why did you think I was talking about fruit when you answered fruit? Why do you think? Yeah. Thank you. Someone used the word context, and this is what I'm coming at. So in order to interpret the meaning of this sentence, we need more context. And as Harpreet said, we need to know more information. Okay, we need to know, maybe before and after this, I've been talking about something about, healthy habits. I love to eat fruits, and you have seen me always having an apple in my lunchbox or whatever. Like this, you need a lot more information about me to be able to correctly infer the meaning of this sentence. Okay, so that's called the context. Okay, now let's relate these examples to these large language models that sit behind these tools called ChatGPT. So what ChatGPT is doing, ChatGPT has been trained on lots and lots of English data. And all it's doing is to predict the probability of the words in a sequence. Okay, and how does it know that? Because it has been trained on so much of data that it's able to look at various different combinations. Now, how does it arrive at one answer? Then it looks at the context. the context may be given to you, or it tries to predict that. And that's why sometimes its answers are correct and sometimes the answers are not correct. Why? Because if that data, if the correct context of that data is not in the training set, it's not going to arrive at a correct answer. And I don't know if you have noticed this, a lot of the time it will just create a false reference. People who are looking for like reference to a book or a book's name or a scientific journal paper name, it makes up those answers, and we call them as hallucination. And why that is happening? Because it's a design feature. First, the program is designed to give you an answer, and secondly, if the answer it can't predict the accurate answer, it's going to go with the best possible prediction it can make. So it's just a prediction, right? So in the end, what we are predicting, what these text-based chatbot models are predicting, is the sequence of the words and the probability of those words. Like what would be the best prediction? Like you just did when you had to complete this sentence based on your experience, based on your knowledge of this language and this world, you were able to answer those questions. And for LLM, the world is the data it has been trained on. So you may have seen when the early version of GPT came, it couldn't predict things that were happening in recent past because that wasn't part of this training data set. But you need to remember that you need to have, when you are using these tools and it's giving you an answer, you need to have your human judgment. So what we call as human in the loop, to be able to correctly infer the outcome from these models. Because these are not thinking, the models are not thinking. It cannot tell whether you are happy or sad, or whether something is a fact or a myth. It's gonna go and predict based on the information that has been provided to you. Okay, and the more sometimes more information is better, and otherwise more information may not be better. It might start spitting more what we call as fabricated answer or hallucinated answer, and it's happening very commonly. People go and search for these reference articles, these books name that don't exist. There've been a case where a company was sued because their chatbot, I think it was a travel agency or something, and maybe travel airline, that it created an itinerary that wasn't possible, and then chatbot also promised a refund, and then the person had to then fight a case to get that refund because it was the AI that had predicted that. Now, so these are some of the things that I wanted to talk about in terms of generative AI and introduce some of these terminologies. But my main point that I want you to take home is that you need to understand that these are just bunch of software, and these are the models that have been trained on the data, and then they may have limitations. So you need to question when you're trying to use them for your work, for your professional task. You need to question, like, is this the correct answer? How do I evaluate the answer? Is this how I can use it? And also, when you're putting in information, where is that information going? Where is this software set up? Is this in your private setting, or is this in a public setting? Is the information that you're putting in sensitive? Should it be going into these public servers and be used by the companies that are running these software, or the information is more private and sensitive? And if you still need to use these tools, are there more local installation that are available where you can use them? So, and I can take questions on this, and we can discuss if there are some other aspect you want to discuss. Okay. Now, again, bringing back to the topic, like making a connection of this generative AI with the healthcare. So now we know that it's possible to build these generic language models, and we call them as foundation model. So ChatGPT now is a foundation model of English language, and it has been trained on various type of English text. Now think about building these foundation model for medical data. Now, if we have these foundation models, it can answer all the medical related questions for us. It can be used as a chatbot facility, and there are you will see chatbots being used in the hospitals, and now it's able to answer all the generic questions of people, and you don't need to call or go and stand in the queue. You can get all those generic questions answered based on the information of that hospital in just through a chatbot. It could be used to generate text, generating documents, generating a discharge summary or a prescription, or finding common information from multiple patients. And then it could also be used for predictive modeling. So that's a exciting application of this technology. And obviously, every technology have had two sides. So there are two sides to a coin. And when ChatGPT was introduced, this was the fastest adoption of a new technology that was seen, maybe after Pokemon, where within a year there were millions of users that had subscribed to the technology, and there have also been misuse that you may have seen in the media. But at the same time, all these big, tech giants have taken an initiative to adopt this technology and then connect with the healthcare industry and seeing this as a business opportunity. And then there've been, as I said, so many examples, positive examples of the use of this technology in terms of improving the most commonly is the administration and in the hospital, doing lots of image analysis, doing better diagnosis, early diagnosis, personalized medicine, and personalized treatment plans. And then what next thing that is, we are seeing in the healthcare domain is the development of this AI agent. So we talked about machine learning, we talked about, predictive modeling, we talked about generative AI, and then what we have is agents. So agents are just next evolution of these AI models where the agents can take autonomous decisions. Okay, so you may have, I noted down an example of this earlier. So you may have, let's say, some AI agents working with the airlines on airlines website and say, these are my conditions, can you design an itinerary for me? Or now you think about those in medical settings, and then this was the news from China where we developed the first AI hospital, meaning there were these AI agents that were specialized doctors in 14 to 21 different categories. So that's the next thing where you are seeing more autonomous decision making from these AI tools. Now we have talked about AI, two different kind of AI, or maybe three different kind of AI, predictive, generative, and the agent AI. And we are looking at all these promises and why this is, it's possible to be able to use this AI to make new discovery and do, healthcare in a different way. But it also comes with its own challenges when you try to use this data. When we are working in the healthcare domain, the data is sensitive. It's personal data. There's a lot of personal information of people when we want to use that data. And that's why we need to have, we think about how this data will be shared, who will use the data, who will be authorized to use this data. We need to look at the cybersecurity. We need to look at the ethics and the legality of using the data. What are the different factors? Do patients have consent to use their data for research or some other purposes, some other use? Is it ethical to use that data? Has an ethical process has been followed? Because it's personal information, how you store, where you store, and how you access the data. There's also then cybersecurity around it that needs to be built. And after you have, gone through all of those steps, then finally, when the data comes for analysis with people like me, then we look at, okay, what are the other technical issues in using the data for modeling? And so there are these multiple layers of different hurdles that need to be first resolved before we can start making use of that data into practice. And I've summarized some of these challenges in a book chapter that I've cited here. And so for this reason, because healthcare data is not easily usable, because its personal and sensitive nature, and also lack of policies, lack of laws around how this information can be shared, lack of standard practices, how we can have data sharing, let's say across a state, across a chain of hospitals, across country, internationally. So there are lots of factors to think about, and that probably is one hurdle that comes in the way of making new innovation in the healthcare domain. And majority of the innovation has happened in the image analysis, because this lot more data became available early on from radiology and other imaging services, and that's why it's also possible to reproduce some of that research work, because there's more data available, and so that the results are more robust, because there's more samples that have been used in developing those research outcomes. Okay, I'll be now moving to the next topic, but I'm happy to take any questions here, if you have any in the chat. How much more time do I have?
I think, Sonika, we can finish in, if how much time you want. We can
5 more minutes.
spare 10 minutes for discussion. You can finish in 5 minutes.
5 minutes, yeah.
Thank you.
Okay. So earlier I was talking about when we develop AI, we need to think about what data we are using and what data is going into the models. Because if you don't think about where the data is coming from, where it's being used, you may run at the risk of introducing bias, or there may be bias that already exist for the population of the data what you're using. So you won't believe, like, all the initial development that have happened in AI, it has favored white Caucasian male, because that's where majority of the information had existed when AI was being developed in early age. So meaning the data is biased towards that population and may not do good prediction or more accurate prediction on other population, and that is called a historical bias, because historically there was more information and more development was happening for certain section of the population. The other type of bias is representation bias, meaning how you sample the data. And I gave this example of not including pregnant women in your sample when you're developing a model for predicting diabetes. And then there are technical level biases, which may be on the basis of how do you measure something? What is the medical definition of certain disease? So when we said COVID-19 infection, how do you describe that? And different countries, different hospital, different healthcare system may define that condition differently, so that there could be a measurement bias. And then the choice of computational models, how do you interpret the data? There could be biases at that level. And because of these biases, we run into this problem of not generalizing the modeling to wider population, and that is called the lack of generalizability in science. So so just to summarize, AI will revolutionize diagnosis and treatment. Machines do outperform human tasks already in imaging, pathology, and risk prediction. Personalized medicine is being powered because of the generation of more data, and virtual assistants reduce clinician workload, and then obviously overall it leads to more cost-effective model. But there are issues related to the quality of the data, the biases, poor generalization, lack of explainability, and how do you explain to a doctor how an AI model arrived at a certain decision. And then limited regulatory and legal frameworks. These frameworks are still being developed around the use of AI in healthcare. How do you integrate, when you develop this model, how do you integrate those into an existing clinical workflow system? It requires not only the investment in infrastructure, but also training the existing people who are using those traditional clinical workflow. How do you upskill them to build workforce that can start using these new technologies. And sometimes, if you overpromise, you would also earn distrust and hesitancy from both the clinicians and the patients. And there are generative AI specific issues that I've already touched upon on the data privacy and hardware requirement, because these are the big models, big data, big compute that are required. And this is the hype, Gartner hype cycle, and I've already talked about these things, that when a new technology is introduced, initially there'll be a lot of hype that can happen because of various reasons. And then when the new expectation that you set, those are not met, it can bring out negative publicity that can reduce the adoption, but the acceptance of good practices, standardization, ethic, governance framework will help you in adoption of that technology, and the trust builds, and that's when you see this stable curve of adoption of the technology and its application. I'm also part of this committee where we are developing a national policy for Australia for AI in healthcare, and we have already, we are in phase 3 now. We have released new policies, roadmap for various kind of policies around safety, ethics. I don't know what happened to the text here, consumers, industry, and research. This is from my paper again. You have access to the slides. I know when you're developing a new AI model, what are the considerations? It's like a 10-step guide to how to get started in developing new AI. And yeah, just to my final point, that AI does have potential to transform healthcare and improve patient outcome, but a lot more work needs to be done around inclusivity, sustainability, as well as the governance and legal and ethical side of things, and making sure we're always making sure the technology, the way we are developing and implementing it, aligns with our values, and it aligns with keeping it human-centric, that it benefits humans. So with that thought, I would like to just conclude.
Thank you, Dr. Sonika. I have no words to express my, thanks to you. It was really a feast. You explained, you carried out through the entire journey for AI, generative AI and machine learning. And I think it was just, just like, hearing a story from your some grandmother or something like that. So you get introduced to the fascinating world
Oh,
of
thank
artificial
you.
intelligence, and you have beautifully, touched all the points. I think for a common layman point of view, I think all the participants must agree with me. It was really, something you touched each and every aspect so beautifully, so nicely, and we are proud of you. We
So
are
much.
honored to listen to you. Thank you very much once again on behalf of all the participants. It was personally, I learned a lot today. Thank you very much.
Thank you.
And the house is open for question answer, and I hope I see some smiling faces from the among the participants, and they might bombard you with questions, and all the best for you. Thank
Happy
you.
to stay back and take questions. Yeah.
Yeah.
Who wants to start?
May I?
Yeah,
Yeah.
sure. Great.
Good evening, ma'am. It was such an informative, and I'm a MSc Biochemistry, but I'm running a school. Your protein structure has just been, I got nostalgic. I just got glimpses of my Nelson Cox biochemistry books and all that.
Yeah. I can imagine.
So, being a millennial, um, we are very tight hand on this AI and all that. We are into all these things are new for me. And as for my question is that you were talking about the minority data. Like if some as a very rare case diseases are there and a sample would be very small. So how come that is going to be reliable for the like AI?
Yeah, so this is why I'm saying, like, we need to think about these factors. So we need to think about what is our interest. So from this data, what is the feature of interest that we want to predict? Okay, then we want to look at how prevalent this is in our training data. So if you are developing a machine learning model and we are collecting data or getting data from somewhere, we want to have a good idea of how prevalent that target predictor is in my population, and keep that into account when you are designing your study. So you cannot just have one solution to all data question. You cannot have the same AI design working for every single problem. So you will have to design keeping those factors in mind. And then you say, okay, because it's already the feature that I want to predict is already rare, how do I evaluate what's coming out of the AI modeling? How do I evaluate which metric will give me more informative answer or more reliable, more confident answer? So it's also about how will you measure that? How will you measure the success? So the most common factor, metric to measure modeling performance is looking at the accuracy. But here accuracy may not be enough. You want to look at other technical parameter to be able to say, yes, we are confident that we are able to predict this feature correctly. And sometimes AI may not work if you don't have enough data.
Thank you. And now, in a contrary basis, like I have heard about, I read one of the article. Like now, this is a very common of the mental hygiene. Some of the AI model was working on this. The girl, she was a very, very renowned. I mean, she was I think tracking me. I mean, I don't know what was her profile. She was having all these suggestions from AI. And somehow AI was not being that humanized that it can't supported his problem, and she suicide when she opted for the suicide. Now her parents are yeah, please.
नहीं वही मैं बोल रही थी, like this you need to so this is why this awareness and education is important कि टेक्नोलॉजी को कैसे यूज करना है और टेक्नोलॉजी की लिमिटेशंस क्या हैं. So then that's why you need to bring in your human judgment to see, is this the right technology for me? Can I use it? And then how do I use it? And how do I verify what is coming out of it? So it's a long process. And once the technology has evolved enough, then you start trusting it. Just let me give you an example. If you're using a GPS system on your phone when you're driving, how many times you may has anyone taken a wrong turn just following the map and just completely ignored the road sign? Has anyone taken a wrong turn?
Yes,
It happens because we're trusting the technology, because majority of the time the technology is giving us correct route, but then and we start trusting technology so much कि हमारे सामने रोड साइन लगा हुआ है कि यहाँ पे रोड क्लोज्ड है, कुछ हो गया है, and then we are ignoring that and keep going. So that trust level comes, Gartner hype cycle that I was showing, it goes through that process and it reaches that trust level. So it takes time. If there's a whole evolution of any technology.
Don't you think there should be an advisory or some of the things like a
yeah. So those regulatory bodies, the ethics, the legality, the standards, the laws around it. So yeah, so all of that will manage this. So like any technology that has been invented in the past. Yeah. Anyone else wants to take a question?
I just wanted to add to it. I think if you remember, there was a recent study from MIT where they compared the brains who used AI to do
GPT
some
and
task,
yeah.
and the other one, and it was surprising that the people who used AI, Chat GPT, they were not able to remember what they write, a long paragraph or a long essay after 15 minutes. So that's a serious cause, because we are not utilizing our brain. We are relying on the machine which are trained, but in the other hand, we are making our brain not to be trained. So where the society will go if we blindly follow all these things?
Yeah, so you need to see where the technology currently is. So currently technically we call this weak AI, because it cannot mimic the human cognition. That's called artificial general intelligence. So we are far away from general intelligence yet. So what we can, the kind of decision making, the kind of problem solving that and cognition that human brain can do, we are not able to mimic to that level yet. So that's why we need to have human judgment when we are using this technology for any task. So we cannot be slave to the technology. We use this as a support to help us. Yeah, so there is a question in the chat. What would be the best approach to integrate AI and data analysis to land into a data analyst career? So pick your domain, which domain you want to apply the data analysis, and it goes across everything. You pick any domain, you can have data analyst career there. So pick your domain. Then you need to see what expertise you will develop. Do you want to go more on data science, where you are looking at various techniques that can be used to build a story from data? For example, some business question, what will be the new product, which are the customers coming, what is the forecasting and that sort of thing. Or you want to do more AI engineering, so building these architectures themselves. And so there is, or there can be operational aspect of it. So you need to see which aspect you like more and where you have your skill sets already, or where you want to develop your skill sets. But as I said, everywhere there's more and more data is being generated. So more and more people with the domain knowledge as well as these digital skill sets will be needed and are needed already.
I think Dilpreet, I can help you he had another question. So I just want you to help. If your domain means if you are from the life science student, for example, or for a computer science domain, or maybe some management or domain. So I can we both are belong to the life science domain. So we can give our example, because as Sonika said, that AI is new to the world. But to the biological data analysis, bioinformatics, machine learning, and AI has been used, since for a long time. And the reward was just the Nobel Prize in physics, and even the Nobel Prize in chemistry that recognized the efforts of AI in biomedical
The
sciences.
AlphaFold work, yeah.
AlphaFold. So bioinformatics is an excellent example where you automatically integrate a lot of AI, and from there you can have many different shoots, whether to go to the data engineering side or data analysis side, or maybe the research side and other things. So that all depend upon your domain. Yeah.
Thank you.
So now, for example, Sonika started from bioinformatics, and now it's working healthcare, like healthcare domain, which is a very larger domain.
Yeah. So your concept, you need to, so whatever you're learning, your conceptual, your foundation should be good. So if you have any skill set, any technical skill set, they may be transferable in another domain, and that's why it happened. Like starting from genomics, we were able to move into healthcare, because at the end of the day, it's data. Either it's text data or some number data. And if you have skills to process that data, analyze that data, then you can apply those skills, the same skill sets in a new domain. Then you need to develop that domain knowledge. So you will have to, so you're always learning. But as long as you have your foundation, some core foundation skills that are strong, that will help you navigate these different shoots, as Harpreet said, in your career trajectory. Okay, anyone else?
I think we are perfectly following the timeline. Dr. Gagan will be happy with us, I hope. Yeah, she's smiling. So, Dr. Sonika, मन तो नहीं कर रहा आपसे विदा लेने के लिए. We are enjoying a lot this discussion, and discussion keep on growing. But we will definitely, it's a time to thank you a lot from the entire organizing committee, and from the entire, the family of HMV, for sparing your time. I just wanted to, convey to the audience that Sonika is around 9:30 Australian time, I think, Sonika, and she's still working in her office for us. And this is
It's
a
a Saturday.
great help, great commitment from her to her profession, to her to the noble cause. She not only profession, but she's always happy to help us, help the communities grow. And that's why I said that many of my students have been motivated from her, and they are working in topmost student at the world level. And Sonika has been a great inspiration for all of us, for me personally,
Thank you
for
so
all of us. And
much.
from today onwards, she will be for your inspiration for you also. Thank you very much, Sonika, for sparing your time. And
My pleasure entirely. Yeah.
thank you very much.
Okay. Bye.
Gagan, any Dr. Gagan, Gagandeep, anything you want to add?
Thank you so much, Dr. Sonika. It was really very wonderful listening to you here. And I'm really thankful, and I hope to see you in our institute also.
Yeah.
Mm.
Bilkul. Okay. Thank you so much.
Thank you, ma'am.
See you
Thank
later.
you.
Okay.
Thank you, ma'am.
Bye.
Thank you,
Thank you
Sonika.
so much.
Bye-bye. Take care. Yeah.
Bye, ma'am.
Thank you all for joining and staying back. Bye.
Yeah. Thank you.